Being told that I have malignant cells, essentially being told that you have cancer, very, very scary.
His world was turned upside down.
In all honesty, there was very little hope that he would survive another 6 months.
At this point, he starts worrying about dying.
What else is out there?
Anything that was out there, I was going to consider.
Everybody is an individual, and everybody's treatment plan should be individualized.
There are other options.
Welcome to The Incurables. I'm Don Wildman. Of all the forms of skin cancer, melanoma is by far the deadliest. It accounts for more than 75% of skin cancer deaths. Melanoma is especially lethal when it has metastasized or spread beyond the initial site of origin and begins traveling throughout the body. At that point, it is almost impossible to stop. Joe Brown was a young college student when a lump on his neck surfaced and started him on a harrowing, years-long roller coaster ride of physical and emotional trauma. But Joe's story is one of unwavering hope and determination, an inspiration to the people he now reaches as a result of his battle against one of life's deadliest cancers.
He was a healthy young boy with no worries in the world, and all of a sudden now his life was on the line because he had metastatic malignant melanoma, which is one of the worst type of cancers that you can have.
I focused all my energy on being positive. It was difficult.
He had no symptoms at all throughout his whole ordeal with melanoma cancer.
You don't always have to have symptoms or pains or problems to have cancer.
No physical symptoms. Never lost weight, never had nausea or any of those type of things. Just the emotional, I can't believe this is happening to me and I'm scared. I don't know if I'm going to live another day.
You know, as good as our CAT scans and MRIs are, they only pick up images that are certain millimeter size or larger.
He really was a sick young man. You know, I knew eventually and down the road he was going to be okay. I knew that.
Joe's mom raised her son alone in the scorching suburbs of Phoenix, Arizona. By all accounts, his childhood was fairly normal.
Joe was a good kid growing up. He could be mischievous, but he always had a good side, sweet side to him. A little devilish at times. Sometimes he would wear my patience, but on a whole, he was a real good kid.
Joe did well in school and showed an interest in the fields of science and medicine. He was uncertain about his exact plan of action, so he enrolled in a local community college. It was about this time that the first signs of trouble began.
When I was about 2.5 years into the junior college, I was going full-time in school, and I got to a point where I needed to shift over to the major university.
My mom had passed away in October of '97. Joe and I went back there for the funeral. When we came back, he came down with a real bad cold. And that's the sickest I've ever seen him in a long time. His gland was swollen, and I personally really never thought anything about it, because when you have strep throat or, you know, a bad cold, your glands will swell.
The gland on the left side of my neck started getting larger and larger, and it stayed like that for about 6.5, 7 months.
You could definitely tell that one side was a little larger than the other.
I really just thought that the lymph node gland that was swollen was due to having the cold 2 or 3, 4 months previous to that.
I kept saying, you need to go to the doctor, you need to go to the doctor. And it was like, no, I'm okay, Mom. And finally, in January of '98, I finally convinced him to go to the doctor.
I went into the primary care doctor. He ran all the blood tests, mono tests. Everything came back completely normal, so he was a little puzzled on what exactly was going on.
Joe's primary care physician decided to send him to Dr. David Sims, an ear, nose, and throat specialist.
I think he first thought it was a cyst and really nothing to be too concerned about, and he was referred to our office to have it evaluated, which is a pretty good size lump. It's like a big gumball in the outside of his neck.
he did a needle biopsy of the gland in his office that day. And at that point, I had went home and kind of went back to my regular routine of part-time school, part-time college, and then working at the computer company. And I got a phone call about 2 days later saying I needed to come back into the office. He had told me that the biopsy had showed malignant cells, possibly melanoma, that was already in the lymph node glands, and that he needed to set me up for a immediate surgery that next Friday.
We were all shocked. I mean, I was shocked and they were very shocked about the diagnosis.
Now I know that, if a doctor calls you back into the office 2 days later, that it's not good news.
Joe Brown was working his way through college in hopes of becoming a doctor. Suddenly, he was facing life as a cancer patient.
Once he went to the doctor and got the news, he called me at work and said that he had malignant melanoma cancer.
The biopsy had showed malignant cells that was already in the lymph node glands. It was malignant melanoma, late stage 3, bordering stage 4.
I thought they had the wrong person. There's no way he could be sick. He's too healthy.
It's always hard to tell anybody that they have cancer, but especially if it's a young person. And especially at Joe at his age, all he was worried about was maybe the next test at school or his next job or what he's going to do that night. He really hasn't thought much about his life could be coming to an end, fairly soon.
Melanoma is the most serious form of skin cancer, a cancer that takes root in the pigment-producing skin cells called melanocytes. When the skin is exposed to too much ultraviolet light, these melanocytes can grow abnormally and uncontrollably, often becoming cancerous.
Once the skin cancer metastasizes to the lymph nodes, then the disease is essentially disseminated, widespread, because now it's in the lymph system and it can spread to all parts of your body. His chance of survival beyond 5 years is less than 10%. The problem with